Today I'm joined by Peter Rowland, who's the Managing Director from MicroX. Peter, welcome to the Morgans Network. I wonder if we can just start by asking you to explain the MicroX company and the technology.
MicroX is a company that's been set up to exploit some carbon nanotube technology that we've got from the University of North Carolina. Basically, it's a fundamentally new way of producing X-rays in an X-ray tube that's much smaller, lighter, and much more energy efficient. And it's an electronically controlled X-ray tube. And the benefit for that is it's smaller, it's lighter, uses less power. That's allowed us to develop what we believe is a game-changing new mobile X-ray card for medical imaging applications. We're going to market with this product through a distribution partner, Carestream Health, based out of Rochester, New York. It used to be Kodak Medical Imaging. They're the global market leader in mobile X-ray. They got about 40% of the first tier market. And we signed a deal with them some years ago. They've collaborated in the development of this product. And within a few weeks of market release. So it'll be, we already have our 510K approval from the FDA, and we will be delivering to countries and customers of Carestreams very soon.
Oh, very interesting. Peter, the technology is being manufactured in Australia. Can you tell us a little bit about the manufacturing process and where the workers have come from?
Yeah, we set up in Adelaide in a greenfield site that, with some assistance from the South Australian government in the Tonsley Innovation Precinct. But because it was a greenfield setup, I deliberately wanted to introduce the culture from the auto industry. I've long admired the way in which the auto industry, particularly out at General Motors Holden, their quality and cost focus and the reliability of their products is enormous, and I actually wanted to introduce that into medical device manufacturing. So we've with collaboration from Holden, recruited all our manufacturing management and operations workers from Holden, and it's been a great move that won us a lot of benefits in terms of our approach to quality and efficiency in manufacturing.
So the first product going into the medical industry, what other applications do you have for the technology?
Well, because the X-ray tube is electronically controlled, you can do lots of other clever things with it. We got a contract a year ago from the Australian Defence Force to do a prototype, benchtop prototype of a backscatter imager, which is something that you would use for standoff X-ray imaging of potential explosive devices. The Army and indeed federal police, when they're doing counter-terrorism, investigating bomb threats, they need X-rays to know what kind of device they're looking at. But currently the only way you can do that is by dressing somebody up in the explosive suit, getting him to stand over the device with the imager and the imaging plate to get the image. Obviously a hazardous kind of a job, so they're looking for the technology that we could get because it's a standoff imager, we could mount it on a robot instead and just drive the robot up, have a look inside from a single viewpoint. And we successfully did our first imaging demonstration of that to the Army and the Defence Force last week, and they're very, very excited. The quality of the images that we've got are absolutely outstanding. So we're engaged in discussions to take that to the next level, but that's a very, very, very exciting product. So MicroX's future is going to be split between medical and security defense applications of X-ray imaging using this new technology.
Certainly sounds quite fascinating. In terms of an investor point of view, what should investors look for over the next 6 to 12 months in terms of milestones that the company is likely to hit?
We'll obviously the last part of the commercialization process with Carestream of the nano, and the first sales of that will be going out to the US and Europe. And as our production ramps up through the year, we'll be developing the backscatter imager through the middle of next year. Hopefully by the end of next year, we'll have a deployable prototype that the military can actually take into an operational situation and use. And then we have some other new interesting product ideas as well, that some of which generated from our distribution partner. Ideas about how we could do a bedside CT using the same technology to produce a three-dimensional CT image, but small enough, again, using this technology that it could be done bedside. And there's some more imaging modalities using this technology in the far future as well.
Very interesting. Well, we're seeing some very interesting technology come out of the Australian market, and MicroX is one of the leaders in this space. So all the best over the next 6 to 12 months, Peter. And I've been joined by Peter Rowland, who's the Managing Director from MicroX.